Now, like I said, we are back to the main type 2. Diabetes mellitus. Yeah, when I heard this first, it was very funny, but yeah. It's a chronic condition where the body doesn't produce enough insulin. I've explained before now, but let's keep going. Or does not use the insulin properly, leading to high blood sugar level, hyperglycemia, increase in blood glucose, hyperglycemia. Just get increasing. Now the common symptoms I will list again: increased thirst. I'm always thirsty. Frequent urination. Oh, in the toilet. Fatigue. I'm tired. You want to sleep. You want blood vision. Yeah. Are you seeing this thing? Bring it closer. Bring it closer. Since I've already to the hospital, let's go and check it. So there are risk factors which include obesity, lack of physical activities, genetics, family history, and is often managed with lifestyle changes and medication to prevent serious complications. I think they'll catch me here, but let's keep going. Let me don't go further. The symptoms, yeah, increase in thirst and all of that. So now causes and risk factor. Causes, we say insulin resistance. That means the body cell does not respond normally to insulin, and normally to insulin, yes, there is insulin deficiency. The pancreas can't produce enough insulin to meet the body needs over time. Pancreas. We also have obesity and being overweight. Don't come for me, oh, I'm just a chubby girl. But let's go to people that are overweight. I'm not a junkie. I don't eat junk like that. Yes. I don't take junks. I'm a healthy baby. I'm a healthy chubby baby. Let's keep going. Before you say that are you not fat? I know you people very well. You start pointing to me. Let's keep going. So like I was saying, obesity and being overweight. Yeah, obesity is what you discuss by yourself. You are just there, you eat. This is a chief risk factor, particularly carrying it for around the waist, fat around the waist. Like if you see me stand normally, it's not around my waist. My tummy is for, see, let me just start going to myself. Let's just continue. So I said obesity and being overweight. So you have to cut down. This mainly his lifestyle. This particular one has to do with lifestyle. You know, some people, well, I'm lazy, I don't have strength to cook. Pizza, burger, ice cream, what they call it again, shawarma, and they'll catch me. But shawarma, you will sit down on one place, so you're not doing anything. You just keep ordering, and there's no physical exercise. Not that you're exercising yourself. Oh, you are eating healthy. You are eating too much fries, which contains too much calories. You are eating how will I call it, unhealthy fats. Just bringing unhealthy fat causes you to increase, and you start procrastinating it. No, you are prone yourself to diabetes mellitus. Lack of physical activity. Exercise help the body use glucose for energy and improve insulin sensitivity. So when you are not exercising enough, you are prone to having this, because the glucose gives energy. So yeah, they're expecting you to. Why am I giving it to you if you're not using it? That means they're asking me to keep it for myself, and I keep increasing. I give it to you, so use it. Yet the insulin is being given to us. The glucose, sorry, gives us energy. It gives us energy, so it's expecting us to use it. Go work out it, then come back, eat healthy. Even these people that takes all this beer, they are prone to it, because majority of this your beer contains sugar, just like your cokes. So this your carbonated drinks contains a lot of sugar. So yes, you are prone to it. Your lifestyle matters. Stop living a sedentary lifestyle, staying home, procrastinating, not doing anything. I went out today now. Is there anything? No, my dear, go and work out. Even if some people say they like themselves being chubby, yeah, I'm part of them. But you have to be fit. That's one thing. Keep fit. The next one is genetics and family history. You have the tendency to develop. If your mother has it or your mother has it, there's a way it finds itself back to you. So you have to be very careful. Live a life that will help you. Don't be a sedentary lifestyle like people. The age, yeah. The risk increase with age, though it is becoming more common in younger people due to rising obesity rate. Now they keep talking about obesity. You get, they keep talking about obesity. Why? Why are young people doing this? You think it's all about enjoyment? Yes, you want to enjoy, but learn to keep fit. Most of these drugs, these drinks you take, carbonated drinks, your beer, your hot, they all have some levels of sugar in them. And when you take them in excess, when you start abusing it, start taking it in excess, you are prone to having all of this, and you don't even do any physical exercise to burn them out. Try to keep fit at least, to burn most of these things you are taking out. No way, you are just there, let it just be increasing. There is no, which space you have in your body, and you keep downloading yourself with food. You just keep eating and eating and eating without thinking that, oh, what would this life look like? Or so yeah, increase normally. Most of these things affect older ages, but recently it's now affecting more of the younger ones. Sharp, may God help us. Now, certain ethnicity, people in Africa, Asia, America, India. So yeah, it happens. It's literally everywhere. It's common. There is management and prevention. One, lifestyle changes, eating healthy diet, controlling portion sizes, and getting regular physical activities can help prevent or manage the condition, my loves. Yeah, lifestyle is something I got to learn on my own. Yeah, you can do it. Yeah, thank God for TikTok and what they call it, YouTube, that have helped us right now in shaping us into some certain things. Everybody now is trying to meet up. Hopefully December is round about the corner. You know, use obesity and enter inside there. So start living a good life, like life of activity. Try using the energy that the glucose gives, because one thing I know of as a student is something I've learned, that you see the brain, it doesn't store, like it doesn't store, it's one of the most stingiest, greediest part of the body, one of the greediest organs, I will say. It doesn't store, because once you give it, it uses it immediately. If you like finish eating as a student, all students can attest to that. You just finish eating and you go and open your book. Before you finish like 3 to 4 or 5 pages, you are hungry, because why? The brain have used all the energy, and that is what it is meant for. The glucose came for you to use it. Use it, but use it right. You don't just overuse it like that for meaningless things, and you're not achieving anything. Use it right. Exercise, keep fit, portion size, control it. So not everything you see that passes left. Buns abeg come. Akara abeg put 500. No now, look at your fry you are putting into your body. So you have to eat right. Lifestyle changes. Also, all this beer parlour, madam, one crate of Heineken, Hero, all those things are very very bad. Look at you, are putting yourself in. As much as diabetes will be involved, your liver is at stake. Is alcohol abuse. There are a lot of things that comes with lifestyle changes. And our young people these days think that all of these things are just enjoyment. But yeah, yes, enjoy yourself. I'm one person that will never stop anybody to enjoy themselves. But enjoy it right, so that you can enjoy it for a very long time. I won't want anybody to die young, because the ages I'm seeing having diabetes, type 2 diabetes mellitus, are very young, 23, 29. What are you doing with such? It's time that you should be enjoying life, but where are you? So please, lifestyle changes is very very important. Then the next one, blood sugar control. Tightly manage blood sugar level through diet, exercise, and medication is crucial to prevent complications. Yeah, very very important. tightly. They not say lightly, they say tightly. Do it with determination, with passion, because it is your life at stake, not theirs. The hospital will just eat your money and there they will treat you. But it is up to you to determine if I'm going to keep living this way. You have to change. Oh. Look at, they still put exercise, diet control. You don't eat everything. You don't eat everything. You can go and Google how. No, there are some certain way you eat the food you enjoy, but if you have the right portion size and proper timing with good exercise, you can enjoy those food well. But then again, may God help us, like I said. Medications. Some medications can help delay or prevent type 2 diabetes in those with pre-diabetes. That is, those ones that are almost having diabetes mellitus. Yeah, type 2 diabetes mellitus. Some medications affect, so it's not everything we take. This one, but I'm having this, you are taking this, you're also causing resistance, having making your body to have resistance to most of these things. So regular medical checkups, always go to your checkup. Is this one that we fail to do most of the time because we feel we are okay now. Oh no, go now, make dem no come dey call big name for me. Oh, I dey fear am. Oh, my dear, everybody does. It's not everybody that wants big name. Oh, but at the same time, we just have to take caution. We just have to be careful because it's our life. So we just have to be careful about it. Then, like I said, you have to monitor, go for regular checkups. What are the potential complications? You have the cardiovascular disease. Eventually, it's going to affect you, leading to have heart attack, stroke, and high blood pressure. Yes, high blood pressure. Because one of those things that leads to high blood pressure is just your lifestyle, especially when you have that what do you call it, obesity. You happen to that a lot. Nerve damage, which is neuropathy, can cause tingling numbness. That's when if you start feeling those numbness around your hands and feet, you eventually don't even feel anything at all. Kidney disease, nephropathy, can lead to end stage kidney disease or kidney failure. Due to all those things, you can have it because once one is affected inside of you, certainly the rest is affected. Eye damage, start having blurred vision. Before you know, you'll not be able to see again. Foot problem, edema, you cannot walk. With edema, when I mean edema, that's swelling. Some people have swelling, some start having ulceration of the foot. Yeah, it's mostly ulceration of the foot because small prick to that leg now, or an injury, it doesn't heal. Before you know, you start having dead skin, your foot start growing and they start amputating, which is not what we want. Skin condition, we start having various kind of skin problems. You are start having gum issues. I told you, like I said, once one is affected, the rest is affected. So we just have to take caution and be very careful. So one thing I mostly advise in all of this is lifestyle, because when I look into those people's and folder and I check properly, some of them, their lifestyle doesn't really go well at all. So you have to be very careful. In as much as you tell yourself, I have a long time to live, my dear, the kind of lifestyle you live will make you have a very short time. Even your grandfather might be healthier than you. Those people are very much aware of most of these things, but we will decide that want to be very ignorant to them. But please, now we know type 2 diabetes mellitus is very common. It's literally everywhere. Lifestyle causes it. you know this can either be gotten from family, something you, when you don't live a good, good lifestyle, like I said, like mostly lifestyle too. Then medication, some certain medications you take, age, or pregnancy, a lot causes it. So yeah, thanks for having, this is the first one. So I'll open for your questions. I'm open for more, like if you want to share more on this topic that you are aware of. Yeah, please, it's wide open for you. Don't worry, there's no discrimination, nothing. I will not stop you. Everybody is here to learn. We are all here to learn and start making some certain changes in our life. And yeah, don't worry, I'm going to the hospital tomorrow. Once I'm back, I'm bringing a new one for us, and we are going to learn again together. So thanks having me here. See you again tomorrow. Bye.